All right, welcome to the Dr. Lexi Show. Today I have a very special guest that everybody knows about anyway. Marybeth Tomory, like amore.
There you go. You got it for sure.
Okay, so then the World Trap Awareness. Trap is a hard one for me because I don't see trap. I think I've seen it once. Have you seen trap?
I've seen it 3 to 4 times. I know.
Really?
And it's one of those things that like, when you see it, you're like, wow, that can be nothing else but trap. It does, like, it's one of those things. Like, I am generally an indecisive person, and in ultrasound, I'm super decisive, right? Like, I can make up my mind very quickly. In life, I'm not like, like that.
I get that.
But trap is so unique and it's so distinguishable. There is nothing else that it can be. Absolutely nothing else, because it has such specific
features,
characteristics.
So World Trap, Twin Reversed Arterial Perfusion is what trap is. World Trap Awareness Day is December 10th. And then we get to National Twin Day, which is December 18th.
So all of those fall in December.
All of them fall in December. So
fabulous.
I think it's easy to say the whole month of December is
all about twins.
Yeah.
Like it.
So I think one of the first things is, because each of the days is kind of there, is, oh man, there's so many places to start with this. When we talk about all the main complications of twin-to-twin transfusion, twin anemia polycythemia sequence, and selective growth restriction. I'll just say growth restriction.
Let's say it the right way.
Those three. We're going to leave trap out.
Yeah,
because would you agree that trap is one of those, like, you see it early on?
If you're looking.
If you're looking.
You can see it very early on.
So let's take the other three, because trap, I think, to me, I think trap is one of those, it's like, it's a different.
Yes.
It's one you're not.
It's rare. It's one you're not. I think you should be aware of it.
Absolutely.
But when you are, especially in OBGYN, and we need to separate OBGYN from MFM, because the goal of OBGYN is to recognize that something is wrong. That is your goal, to be able to, and sonographers are really good at pattern recognition, right? So we learn what it's supposed to look like. And if it doesn't look like that, then you call it. You immediately say, I don't know what it is. And I spent years of my career saying, I don't know what it is. We've got to send this patient, right? So I think for OBGYN sonographers and OB physicians, you have to learn to recognize, I may not know what it is, but it doesn't look right. And that's really the most important thing.
So for World Trap Awareness Day, Twin Reversed Arterial Perfusion, that is December 10th.
Okay.
And you've seen trap before. I think I've had a trap case once. But the general way I kind of explain it is, even though it's a twin type of pregnancy, which is monochorionic, so one chorion or one house. One baby is called a pump twin, and that's the baby that continues to grow.
The typically normal baby.
Structurally. Yes.
Structurally normal.
The other fetus typically does not have a functioning heart.
Right.
However, there is an extra fetus that's there, and the tissue sometimes is disorganized.
Yeah.
It may have bones and parts that look
it's
like
usually
a fetus, but
lower body down, because if you think of how blood comes in, like parts of the babies do start to form. You kind of get what looks like another baby, but not. And it can be really confusing. Again, for OBGYN sonographers, it's important to recognize, I don't think this looks normal, right? That's the important thing to recognize, but it does kind of look on ultrasound that it has something beating, but you can't actually see a heart. And that's what's happening, is it doesn't have a normal heart to do that.
Right.
But there's really only one baby.
Functioning, And the biggest risk for these are that functioning fetus that's there, that looks typically structurally, oftentimes normal, right? Is that fetus can end up going into heart failure or other complications, because there's a shared placenta with this non-truly functioning,
non-truly viable fetus. But if you think you have like one heart that's functioning for both,
right?
So it becomes overloaded almost, like it goes into failure, because it just can't keep up, with trying to support two.
And they call one the one that usually appears like the growing fetus, so they call that the pump twin. And then the small parts that are still getting blood flow, they call it the acardiac twin.
Yep.
And then the question is, what do you do in those scenarios?
Right.
Lots of ultrasounds
Mm-hmm.
and typically getting someone to a fetal therapy center
Yeah.
because
Yeah.
you have an umbilical cord
Yep.
going to this acardiac twin
Mm-hmm.
that is possibly going to cause some very, very poor
Yeah.
outcomes.
Well, it's
for
just
the other.
over time that
Mhm.
that usually normal baby just can't keep it up. So at
Right.
some point, now could that be at 12 weeks, 20 weeks, 28? We don't know,
Mm-mm.
right? But at some point, it just won't be able to pump for both.
Right. Right.
And if you would like to continue that
Mm-hmm.
pregnancy, like we want to take
Yep.
the steps that we know to protect that baby
Yep.
as much as we can.
And you can, in my mind, there's two things to think about with this.
Mhm.
One, when you're continuing to watch the ultrasounds, if the pump twin, the one that looks to be normal,
Mhm.
generally speaking, if you're looking at that twin and everything looks good, you can still look at the umbilical cord of the acardiac twin.
Mhm.
And oftentimes the blood flow over time can really start to diminish naturally. That's
Right.
one,
Yeah.
that's best case scenario.
Oh, best case.
right?
Yeah. Because then we're not going in, we're not doing
Mm-mm.
anything. Like it naturally
naturally-
understands
yep.
that, oh, this is not good. We're just going to slowly
Nothing to
shut
feed
this
there.
down.
Now, if that doesn't happen, you could see the pump twin start to not look good.
Yep. Mm-hmm.
And you have to decide what to do with the blood flow to this acardiac twin
Right.
that we know shall not, will not,
Right.
cannot
And that
survive.
acardiac twin is still going to grow if it has blood flow too.
Correct.
So it's like it still gets bigger because it's just sucking all the life out of our sweet little pump
Yeah,
twin. You know?
yeah. And then options for that,
Mm-hmm.
fetal therapy centers, so
Yep.
they can basically ablate the cord
Mm-hmm.
of the acardiac twin
Yep.
to give the other twin, the remaining fetus,
Yep.
the best chance.
All the love, all the blood, all the placenta, it gets it all. And
Yep.
then hopefully it continues on to a
Yep.
normal pregnancy.
And then you're like a singleton
and
pregnancy.
yeah.
in
And
my
really
mind.
you're always kind of a singleton. But it's really kind of hard.
Yeah.
And especially by ultrasound, again, to see that, like, I think I have twins, but I don't know if I have
Yeah.
twins, but it looks like I have twins. And I can see kind of two cardiac structures, but why does this
Yeah.
one look so odd?
Yeah. Yeah.
And so, yeah, it has a very distinguishing, odd look,
Mhm.
that acardiac twin. And we call it acardiac, right? Because it is no heart. It's like the absence of a heart. It just has these,
You just
like
see
this
blips
cord
of blood
that comes
flow kind
in.
of
Yeah,
going to the parts.
kind of
yeah.
wild.
It's very
kind
different.
of mind blowing.
It's very different.
Mhm.
All right. So that's kind of trap in a
Yeah,
nutshell.
yeah. And the earlier, again, that you're, as you're sweeping through and you're looking, the earlier we diagnose this, the better.
Yes, absolutely.
Always.
That's our theme, by the way. The earlier, the better. Earlier, the better.
Mm-hmm.
Tell me really quick too, the hashtag or your thing on Instagram and all that jazz.
I am Sonowise Ultrasound on Instagram. I mean, I'm technically on TikTok.
Is it the same thing? Is it-
I think it's sono.eyes. That's what I'm on TikTok. And
Okay.
of course, I'm on LinkedIn,
yes.
things like that. So,
All the things.
yes, all the things.
Okay.
Facebook too, but really my Instagram is where
Okay.
the majority of my content lies.
Well, today we did a lot of discussion about twins. Thank you very much to Marybeth Tomory for all of her help and guidance. with
Thank you
everything,
for having me.
Everything ultrasound related, which is
Mhm.
fantastic. And we'll have you back again as long as you'll come back.
Anytime.
We'll make it a
Yep.
regular stop here.
Mhm.
But we hope to have expanded your knowledge, developed some skills, and as always, we want to have an impact on you and your pregnancy. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.